Hello, we're Team 6 and our topic is healthcare diagnostics in developing countries. We chose this topic mainly because of personal preference, and my colleagues are also doing a jump project in a developing country, so it was appealing to us as a topic. And this is an overview of the cases that we first analyzed. They're very varied in typology, in uses, and in context. The first matrix that we use to categorize the products and services is accessibility. So we thought it was interesting to check at the price and the channels through which these are obtained, because in developing countries it can be challenges to access to healthcare. And the second matrix that we used, we thought it was also interesting to look at typology. So whether they were specific or general services and products, and through what kind of, the typology of the product or service. And we saw that most of them were either apps or online platforms and communities. From the first 10 products and services that we analyzed, we chose two. We chose them for having overlapping characteristics, but also for being different. Mom Connect is a very specific service for pregnant women and their babies. It is brought to the users by the government, and it's completely accessible because it's free. And the second case is Kangpe, and it's a platform that allows Africans to contact doctors remotely. As Mom Connect is a mobile platform, but it's a lot more general, so it doesn't have a specific target group or is dedicated to a certain disease, and it is not free since it comes from a private startup.
Mom Connect is a platform that aims to support maternal health and using cell phone technologies. And so when women can go to the clinics, and once their pregnancy is confirmed by the nurse, they can register to the service, and they will receive SMS about their pregnancy. And at the same time, they're able to be registered to a clinic, but also at the national database. Here we can see the gigamaps of the service, and as we can see, the service is located in South Africa and is sponsored by the National Health Department, which means that there are different actors involved in the well function of the service. And in this graph, it is possible how these actors actually how they move their values, such as, for example, the service of Mom Connect give information to vital information to the healthcare workers, and at the same time the healthcare workers give support to the service.
Okay, and talking about Kangpe, it's a platform that connects patients with doctors for remote consultations. So it is paid, and the doctors get a small fee per consult. The patients have then access to the doctors for 48 hours after they have initiated the consult, so they can go back and forward and have their medical questions resolved. As you can see here, the actors, it's mainly the relationship between the patients and doctors having this service as a middleman for these simple consultations. And in the gigmap, we can see down on the right, we have the business model. We can't see now, but it will show up better later, where we see that Kangpe is a startup and it's a for-profit business, but at the same time, they are aiming to provide cheap access to healthcare services. And they're located in Nigeria, where most people have access to the cell phone, to a simple cell phone at least. But having access to a cell phone, it's not all that's necessary, because they need connection. And for that, Kangpe has as a partner the Facebook Free Basics program, where they can provide access to the users without daily consumption.
Okay. Now we are going to talk a little bit about the comparison that we did between both services. And for that, and to analyze them, we decided to use two tools: the value mapping tool and the business model canvas, the sustainable one. And starting by talking about the value mapping tool, we could understand the similar values or the different values between services and also the structure. And they were mainly different in terms of implementation, target group, profitability, and also the doctor's role. So by using this tool, we could analyze by focusing in sections, in the different sections, the way they differ or the way they are similar to each other. And giving an example and analyzing one of them, the customers, for example, we could analyze the difference between the customers of Mom Connect and the customers of Kangpem. And we could see that there were similarities in terms of missing personal contact with doctors, so there's no relationship between them. Also, the cheap service, that the aim of both services is to provide a cheap service to these customers, and also the technical support that they receive. But we could also see that they are different in other ways. For example, one works in a more short term and the other in a more longer term relationship. And the second one, the sustainable business model, was we chose this one with the same goal in order to compare them, but in the sense that we could go more in depth in the structure of the service and see mainly, for example, the resources or the revenue systems, and we could compare these kind of details that we couldn't just by using the value mapping tool. And I would like to give some insights about the use of the tools. So we can see, we saw by using the value mapping tool that, for example, it's a really, really nice tool to empathize with the different stakeholders and to understand the different interests, because sometimes we put all the stakeholders in the same group, and we don't really understand the differences between interests. And here it's really nice to see that. And we also have a clear overview, and it's really easy to compare with different maps. But we also saw some restrictions, and it's a little bit complex, the visual to fill in. But it gives us also detailed information, and it's a really good basis for system mapping, although it's a little bit time consuming. And to finalize, we would like to say goodbye. And in case you have any questions, we are available on our emails, and we can just drop us an email and we will reply to the questions. And more details are in our report. So you can see more information there with the description of all the steps that we took along this process. Thank you.